Hello, my name is Tatiana Polukchi. I am assistant of infection diseases and dermatovenerology department, South Kazakhstan Medical Academy. Lecture number 3, Shigellosis. Shigella is a highly infectious bacteria. Shigella is one of the most infectious of bacteria and ingestion in few as 100 to 200 organisms will cause diseases. And most individuals are infected with Shigella when they are ingested food or water contaminated with human fecal material. Shigella can survive up to 30 days in milk, eggs, cheese, or shrimps. This infection is Enterobacteriaceae group, gram-negative bacilli. It is rarely grown in oxygen and oxygen plus. It is metabolically active, fermenting a variety of substrates. Nowadays, we have some classification. So Shigella have 4 species and subgroups based on biochemical and serological characters. So first group, it is Shigella dysentery. It includes 12 serotypes. Shigella flexneri includes 6 serotypes. Shigella boydii include 18 serotypes, and Shigella sonne 70 colicin types. The Shigella dysentery, most serious form of bacillary dysentery. Shigella flexneri, shigellosis in underdeveloped countries. Shigella sonne, shigellosis in developed countries. And number 4, Shigella boydii. So about morphology and physiology. It is small, gram-negative, facultatively anaerobic, coliform bacillus. It is non-motile, so here no present H antigen. It may be possess capsule K antigen and O antigen. K antigen not useful in serologic typing but can interfere with O antigen determination. O antigen include A, B, C, D, correspond respectively to the 4 species, and non-lactose fermenting. Bile salt resistant, for example, trait useful for selective media fermenting glucose, reducing traits, and oxidase-negative. Factor contributing spread. So spread is always from a human resource and generally involves on 5F. Food, fingers, feces, fleas, or fomites. There is in contact to Salmonella, which are often spread to human from infected animals. Transmission. Fecal-oral transmission is the main path of Shigella infection. Other modes of transmission include ingestion contaminated food or water, contact with infected object, or sexual contact. Outbreaks of Shigella infection are common in places where sanitation is poor. Pathogenesis in virulence factors. So first, it is invasiveness in Shigella-associated dysentery. It may penetrate through nuchal surface of colon, colonic mucosa, and invite and multiply in the colonic epithelium, but do not typically invite beyond the epithelium in the lamina propria. Thin layer of fibrosis connective tissue immediately benefits the surface epithelium or mucous membranes. Next step, it is preferably attached to and invite M cell in pear patches for lymphoid tissue and lymphatic system of small intestine. Clinical feature. First, it is appearing fever. Blood diarrhea, it is typical sign for dysentery. Abdominal cramps, tenesmus, mucus, pus, convulsion. In mild infection may be present watery stool. Bacteremia may be present rare, and hemolytic uremic syndrome may appear like complication in this infection. For diagnosis of Shigella infection, we use culture, stool, we do some rectal swab, which will do check the bacterial material for Marconi, agar, and in microscopy, we can see some leukocyte or RBC present, and acid and 4 non-motile group present. Closely related to Escherichia, this infection, so species like serogrouping and biochemical analysis present, and stool specimen and rectal swabs should be cultured soon after collection or placed in appropriate transport medium, like Carey-Blair medium, readily isolated in selective or differential agar medium, or lactose non-fermented. Rectal swabs may also be used to culture Shigella in specimen is produced rapidly. It is disposed in buffered glycerol saline holding solution. Isolation of Shigella in clinical laboratory typically involves initial streaking for isolation or differential selective media with aerobic incubation to inhibit the growth of anaerobic normal flora. Treating cases of shigellosis. So, mild illnesses, we do rehydration in short period, 48, 7 to 2 hours. And antimicrobial therapy, so we also should to give, like ampicillin, clotrexamazole, ciprofloxacin, or ceftriaxone. Dehydration is problem to attend and treat carriers major source of organism like ciprofloxacin or erythromycin. Antibiotic resistance is major problem, and proper sewage disposal and water chlorination. Oral vaccines of Shigella and E. coli hybrids or Shigella mutants offer immunity for 6 months to 1 year. It is need more studies. For prevention, we should to supply pure water. We should to teach personal hygiene, including washing hands, sewage disposal, using food hygiene, or do some insect control by flea. And the last one, it is using oral vaccine. It has some protection during 6 months. Thank you for attention.